And Gabi was mentioning just before that this process of passing the torch to the new generations has also both sides. Let's say it's a road with both ways. So I would like now to pass the torch to the representative of the most experienced generation in positive psychotherapy. And as Gabi mentioned in the morning, we have the great pleasure of having with us today Mr. Arno REMMERS. And thank you very much, Arno, for joining the conference now. I know that this psychosomatic field, I know this from our last discussion we had in Antalya some years ago. It's kind of we can say it, heritage also coming from your father experience in the medical field, and you took it further, and we are more than curious to hear what you've prepared for us today. So Arno, once again, thank you for being with us in the conference, and the floor is yours. We are happy to listen to you.
Thank you very much, Ovidio. Are you ready already, or do you need a little break for something? Gabi, what do you think about that?
Ivan,
just one word, guys. I should say goodbye because I need to travel to Poland now. Because in 10 minutes I have conference in Poland. So see you then.
Bye, Ivan. Thank you very much.
Ivan. Thank you. So wonderful. Yeah. Also, Ivan, just before you go, to say, I think this psychosomatic arch can be used as well for the somatoform parts.
Oh, sure.
So you can not have only events and symptoms, but you can have events and you can cope with them in a way that you are healthy. And it's the interesting thing that you now integrate in this arc the OPD structure capacities. You involve them, so the personality, you involve the actual capacities, the main actual capacities, the primary capacities that are important for that. And you also include already salutogenetic principles of Antonovsky, meaning, understanding. The only thing that is missing for salutogenesis is manageability, but that has also to do with meaning and understanding, and to create something, how to do something. But it's also on the level of the action that you described, the motoric level. So you have inside included all these parts, and I think we can work it out also in the aspect of attachment theory, for instance, that you mentioned indirectly by love and so on. So many things are to find in there. And I think we can add also the personality influence that has a strong influence on the results of psychosomatic experience. So thank you very, very much for this wonderful further development.
Yeah, I'm lucky to have at least 10 active. We have 60 doctors now trained in Moscow in psychosomatic, and at least 10 of them are actively discussing exactly the salutogenetic part mostly. Wonderful. So we are focused more on this psychosomatic health now. So which is
perfect.
Yeah, and I will integrate these ideas. So the idea of attachment theory I like very much. So we will work on this. Okay. So sorry guys, I have to run.
Bye bye, Ivan. Have a nice day. Hugs to our colleagues from Poland.
Sure. Okay. Bye.
Arno, you asked for a break. Let's say 5 minutes. It is okay.
Yeah. Yeah, to have something for the
to take a coffee or
to take a coffee or to bring it back.
Okay. See you in 5 minutes.
We'll be all together again at 10:55, right?
10:55. Okay.
Yeah.
Okay. Thank you.
Gabi, I could send by the chat the slides then, and also an article.
Yeah, that's great.
Yeah, so what I prepared, it's a little bit more theoretical, but practically I'll do it here with the slides and so on.
That's
I can
very
send
nice,
by the chat if you like. Yeah,
I will send them all the materials during the conference by email later.
Okay, yeah. Mm-hmm.
I'm going to take a coffee and I'll come back. It's okay?
Yes, 55 de minute și propun să ne întoarcem la posturile de lucru, să spun așa, sau în sala mare a conferinței, să lucrăm nemțește. Nu vă spuneam, ne prezintă acum Arno REMMERS o lucrare, are o prezentare în care ne introduce puțin să vedem, ne ajută să vedem capacitățile din spatele simptomului. Și în același timp va fi și o incursiune prin pașii psihoterapiei pozitive. So Arno, I just mentioned to our viewers and listeners just a bit, a little insight about your topic, about what you are going to present us today, and about the things that you are going to help us to understand the capabilities, the capacities hidden, let's say, beside the symptoms, and also a journey through the steps of the positive psychotherapy. So Arno, the floor is yours. Thank you once again.
Yeah, thank you very much for this invitation. This time I would like to start not with the slides, but with myself, as I do it in psychosomatic medicine. The clients coming to us in medicine or in psychology, they first, quite often when they come to me as a psychotherapist, have had a journey from one doctor to the next, from one investigation, from one medical thing to the other. And when they come to me as a psychotherapist, they first usually are sent by somebody who says, you should go there. And quite often, it's very difficult when I would say there are psychological reasons, they would go away and would say, nobody believes me. Therefore, for me, that relation of the therapist and the client is very special in psychosomatic medicine. I call it psychosomatic medicine to link that medical aspect that the client looks at and the aspect of how the soul reacts on the symptoms and how the symptoms are caused by the soul that does not want something maybe, but that's the psychological part. And the clients need to be understood first. So the first thing, instead of slides, are my fingers that I present you. As quite often as a medical doctor, I ask, which are the symptoms? And in which part of the body is it? And what did you take already? Did you take medical things already to treat yourself and so on? In psychotherapy, I ask nothing first. I listen. And I show my clients, first I want to feel how you feel, how you experience all that. And for me, that's what Rogers told us, how to be as therapists. And I see it like of the 5 phases of treatment in psychosomatic treatment, like the first phase, and use the thumb as a symbol for that. The symbol for that unique client that has a unique feeling and a unique, let's say, a unique experience with the symptoms, and nobody doesn't understand this. So I want to be the one who just listens. And just now I have to listen for my cat who wants to go out. I'm sorry, the right moment. Yeah. It's exactly like with the clients. I have to listen what they tell me, not what I think about them. And different from my cat, I'm not reacting immediately, but I try to feel first. And I would say, oh, what do you feel now when you say meow to me? Or how is that? How do you experience that symptom? So the first part for me, my first role for my client is the listener. In research about medical doctors, it came out the clients feel understood if the medical doctor takes at least 2 minutes of time just to listen to them. Even if it's a short time they meet the doctor, then the feeling of this doctor has time for me, he took time for me, is existing. If the doctor starts with a question, clients have the feeling, oh, he doesn't want to listen, he doesn't take time for me, even if the doctor takes 30 minutes. The subjective feeling of, oh, this person gave me time, gave me interesting ideas and so on, comes up with that first situation of just listening and giving time to my client. And that's the first finger. And I use the thumb because as human beings, we are a little bit different from some other animals. We use our thumb to use the other fingers. I cannot, without my thumb, I cannot really write. I have to take it like the children first. And I cannot really take it like to write in that way. For all what I do with my hand, I need the thumb. And it's exactly like in psychosomatic medicine. If I did not listen, I can forget the whole treatment. I need to listen first, and even more, I need to be like the homeopathic doctors or healers. They do not only listen, but they are interested in saying, oh, how is that pain you describe? You say, pain is here in your shoulder. How is that pain? Oh, yeah. Oh, it's painful, somebody says. Oh, which kind of pain it is? I don't know. Is it burning? Is it like hurting with some acid? Or how is that? Oh, it's like a hammer was there, and now it's like, oh, it's like thicker than normal. It feels like when a hammer has been coming up there. And so the client has to describe it with their own words. And homeopathic healers try to find out the fitting words. That's what Ivan said. We need to name the emotions. And in psychosomatic medicine, usually you have a lot of clients who cannot name their feelings. That's one of the reasons they have psychosomatic symptoms. And together, we have to find out when they talk with us about the symptoms, which names, symbols can we give these feelings of the disorder? Which names can we take to describe it in a way that finally the client says, oh yes, you understood me how it feels. From that moment on, I can use my second finger. Then I can ask more than before. And the first finger, I listen and I'm interested. I'm another person. I'm not that person who suffers. So I cannot suffer myself, but I can take another position and look at it from another position, what the client brings in. What does this cause? And this is what I ask then with the second finger. How does this symptom influence your life? And you're a positive psychotherapist, as far as I see you, and you know the balance model. And there, in the second finger, I can ask, how is the influence of these body symptoms on the other areas? How does this influence what you do, your activity? How does this influence your relation, your partnership, your family, the colleagues, the friends? What do they say about that, what you have now? And how does that influence what you are motivated to be, to do? How does that influence your future? What did that change in your life? Psychosomatic treatment is not only psychosomatic, like Ivan said. You can see it also as somatopsychic or somatopsychosomatic. So I just remember a client who had a cancer. And she was a secretary in a company. And so she got cancer of the breasts and was operated. Everything was okay. She was fine with that. And she could cope with it quite well, like in the company where she managed 100 people as a manager of them, as a secretary of the boss, and she managed them. And everything was to manage also with her own body. Everything was fine, so functional. But in the moment when the medical doctor said, now you get cytostatic drugs and your hair will fall out. In this moment, she decompensated, became very depressive, and even wanted to kill herself. If I lose myself, because my hair is the only thing I can change at myself, that's me. If I lose my hair, I lost my priest already. If I lose my hair, I'm not myself anymore. I don't want that. And in this moment, she quitted with life, it seemed, and she came to me through therapy. When she came to me, she said, after I asked her about the symptoms, how is that for work? She said, I never go to that work again. So she wanted to quit with life anyhow. How is that with the relations? How did that change that you have now this cancer and treatment? And she said, with my formerly friend, it's difficult, because when I told her that my hair falls out, she said, oh, you know, there are artificial hair parts, take some. I understood then that she can never understand me. But with my sister, who always had difficulties with me, and I had difficulties with her, when I talked with her and said, oh, the doctor said I lose my hair, she said, oh, that's terrible. How do you feel with that? And then I knew she understands me. Aha, that changed really the relation with my sister. First time in my life after 50 years or so, she said. Before, always it was difficult with her. Aha. And what else is changed in life? I think after I'm now in hospital and after I had been treated, I don't want to go back to the company anymore. I never took time for to have children. I never took time for to learn music, and I never took time for to paint, because I always had been working, because my husband and me, we wanted to build up something in our life. But now I see, what is it what I built up? I lose my hair. And so I understood, aha, she wanted to play music. She wanted to learn how to paint. Oh, and that was an idea. And it was like the inner hope she took with her. She expressed it when I asked her, how is that now? And I asked her, would you like to learn to play something? Oh, yes, I would like to play piano. Is it possible now? She said, I didn't think about that, but it might be. And how is about painting? Oh, I always wanted to paint. I never did it. I try. I said, where can you learn that? Oh, maybe there is an artist around. Let's see. And next time she came, she said, oh, she had an appointment with an artist. And she bought a piano and tried the first. So that was the strange thing, just asking about the influence of the symptom in the balance model. And after some sessions, she became better. But when she came, she was very depressive because that losing her hair. So it's a psychosomatic disorder, you can say. She had a cancer. That's not psychosomatic as such, but it influences the psychic system so strongly in her that she was very ill with a depression, with even suicidal ideas. And the body reacted on that because she didn't move much, she didn't feel well, she felt very bad with that and had psychosomatic symptoms independent of the cancer. So the first thing was to listen to her. How was that for you when the doctor told you that you will lose your hair? It was terrible, she said. It felt so absolutely terrible. It was as if I am not myself anymore. When I heard that, I noticed, now my life ends. That was what she said. The medical doctor just said, oh, I need to inform you that's necessary because I need to inform you that your hair will fall out. But he never asked about how was that for you? How is that for you? And that's what is needed in psychosomatic medicine. How do you feel it? How do you experience it? How does this change your life? So coming back to a systematic approach with the 5 steps. The process of our relation in therapy starts with, I cannot know what you feel, how you feel, but I want to know. Can you tell me more about that? That's the thumb. Please tell me, just tell me. And I had some clients who for 15 minutes just talked about these symptoms. I remember one client, she went to a homeopathic doctor, she sent her to me, and this client had hundreds of symptoms, you can say. And for 50 minutes, she only could talk about all the symptoms of her body. And I wrote down and wrote down and wrote down. And finally I said, okay, I don't want to miss any. Could you please, until next time we meet, write down all your symptoms that we have so that we don't miss any? And she was very serious and tried and got half a page only. But in the meantime, she understood, oh, that's strange. I have so many symptoms, but I don't understand anything of that. Why is that? And she wanted to know, why do I have such a lot of different symptoms, like burning feet? She could not sleep because the feet felt burning. So the first step, the thumb, just to listen to her 50 minutes without asking much, and just to ask, did I understand it that way, that you cannot sleep because your feet are burning? Oh, yes. Did I understand you right, that your shoulder is aching while you go out? Yes. Is it like that, that you have a headache? And yes, and that headache is like a hammer from the right and the left side and pressing your head? Yes, it's like that. So to find what Ivan said, to find words to name these body feelings. And after we went through all these feelings, from that moment on, we could talk more about the life of this lady. So sometimes you need a lot of time only for the thumb, sometimes more than one session, sometimes 2 or 3 sessions, just to listen and to understand how you can describe the suffering of this person. Otherwise, this client will not feel accepted seriously when you are not ready to listen to all of that, even if it needs time. So that's the thumb. And that's also Rogers, insofar as I am myself. I say, what I feel, I give back to my client. So, oh, it feels as if this is like being in a jail for you, locked in anyhow. Is it like this? So you can give back your feelings, your own real feelings, and can name the feelings of your client. All this is first step. The second step are the questions concerning especially the balance model, so the results of these symptoms in everyday life. I'll show you some little slides still. So this is about the process. It's not about what I do. It's more about the process in therapy and who I am in this process, what I want to show. The first step, the thumb, is that observation. I'm sorry. Yeah, you see that? I hope so. Yeah. The observation means the patient's perception and the language of the symptom is the most important, and to find words for the symptoms. Also, my part is to share my feelings and my understanding of the symptoms in comparison to the client. That's changing the point of view. My part is to mirror the language of the client and to feel how the emotional content is expressed. That means when my client tells me, oh, it's like, oh, like this, and we try to find words for that. And together we find the words to express it. And sometimes we need narratives, symbols, stories, proverbs, language pictures for the experience of the client. I'll send you the slides now. Yeah. In the chat, you will have the attachment of the slides also. So this was the first. And you can say, when such a client comes to you, like this hedgehog, for instance, I hope you see it here, up there, the skin of that hedgehog is a symbol for me for what our skin can express as a body language. When I say, oh, I do not feel well in my skin, it's going under my skin, or that does not itch me, or don't come too close to my skin. Oh, this person has a thick skin. That's a German saying. Or to save one's bacon. All these are the symbols or pictures you can see only in relation to the skin. So persons who have itching at their skin or feel that the skin burns or whatever can describe that, and we name it, and while we name it, we already find the first key to the psychodynamic. If I do not feel well in my skin, I have to find out what it is. If something is going under my skin, I can ask, what is going under my skin? That does not itch me. That means, aha, are you angry with that? Don't come too close to my skin. It's about closeness and distance in a relation, for instance. And then we can see the body symptoms and their functions. These symptoms are the ability to talk and feel with body symptoms instead of saying it, instead of noticing the feelings. Instead of feelings, the body shows symptoms. This is also called alexithymia. That means I cannot read my emotions like Ivan described it, and we have to name the emotions. As long as I cannot name my emotions, my body will speak instead of the emotions. Body answers inner conflicts when we don't have an answer. Again, mentalization. That's Fonagy also. To mentalize means to find words for something, to find words for the conflict, to find words for the feelings. If we don't have, our body can react. Perhaps it might be interesting later in therapy to address the body language and to see, with whom the body is talking. Only with myself? Is the body talking with my partner? Not only in sexuality, also at breakfast. Is the body talking with the others outside, with my social environment, with my friends or the group, working group? Or is my body talking with God? Again, why is it me suffering such a lot, dear God? So with whom my body is talking? And this is the start of the second stage then, to see the description of the body reactions and the situations in which the body reaction starts, gets worse, or gets better. That's the relation here. I described already the balance model, but I use it in psychosomatic patients, especially to understand how is that everyday life of the client, at which time this client gets up, how is it in the morning, how is getting up as such, how is food, how is sleep, how is rest, how is relaxation, how is stress worked out, balance model. And within the balance model, I look at the symptom effects in all life areas. When my client talks with me, I can name the actual capacities that this client brings in. Politeness, openness, for instance. Typically, it's politeness that's more often linked with psychosomatic symptoms. Somebody cannot express it, and it's a defense mechanism to have somatization. That means the body talks instead of me. And I name the actual capacities as values. For you, politeness is very important. Where did it come from? And so I ask about the clients and the family history, modeling dimensions, you know that. And the role of the body in the family is important for the clients to know. Then we come to what Ivan mentioned too, the key conflict. Is that person more polite, more straightforward, more courtesy, or more openness? What is the part that I can see? For instance, the stomach is quite often a symbol for openness, politeness, key conflicts. I swallow the bitter pill, politeness. I'm fed up with the back teeth, aggression, but I don't tell you about the aggression. Or what on earth is eating you in English? What is eating you, not what I am eating. Or love goes through the stomach. So you see, in our language, a lot of body symptoms are talking instead of us in everyday life language. So after all that, after we understood how is that in life, how is the everyday situation, then we can come to the longest finger, to the question, how did you cope with it until now? So may I ask you, other questions, are there remarks until now, before I go to the third finger?
I just want to share with you about the first finger, Arno.
Yeah.
How important is for some of our clients to use the words instead of them, because a lot of them,
Yes,
they have no idea about their emotion. They are not in contact with their emotions. So we are an instrument in this relationship to verbalize what they cannot verbalize.
It's my mouth that is necessary instead of the client's body. It's exactly what I named mentalization, what Fonagy names mentalization. That means if I have a right word for it, I can understand my own feeling. If I have a word for it, I can express my own symptom. But most of the psychosomatic clients cannot express their feelings, alexithymia, cannot express their symptoms. Instead of them, I have to do that. That's what I had in mind with the first slide also. What I feel and what I can express instead of my client helps my client to understand oneself. So you see, the thumb is the most necessary to listen. Then I can work with all others. When I understood how that feels and have a name for it, then I can ask, how does this influence your everyday life and balance model? Where did this come from? How was the body experienced in your past? And what did mean the word body for your family, in your family, for instance? And then after all that, I can ask, and that's the longest finger, because this is the strong side of my client, in which way could you cope with it until now? What did you try already? Where did you go to for treatment? What did you take from them? What is your experience with this or that? So your experience, I have no idea what a person with migraine experiences as good or bad for their own disorder. I have to ask about that. And when I know, when I lay down and it's dark, then it's after some while a little bit better. So you need a rest. Your body needs a rest then, and it needs to be dark. So when it's dark, it's better. Yes. So like at night, or like a baby sleeping, yes, like that, that's much better. If it's silent around, so you need a calm, safe atmosphere around. Yes, that's it. And that's third finger, to find out in which situations, with which behavior, and with which own action it is better. For instance, what does help this client? And this is something medical doctors usually don't ask. Medical doctors ask, which medicaments did you take? But they don't ask, what did you do? When I ask them, what did you do until now? Where did you go to? They quite often say, oh yes, I went to a healer. I went to the priest. I went to these. And they will not tell this to medical doctor. Because the medical doctors don't like the healers. The medical doctor cannot understand, why do you go to the priest or the Islamic priest or so. But they will tell me when I ask them, what did help you? Who cared about you? Who talked with you? And what did you take back from that? That's the third step. Just a little slide for that. So the own experience of the client, of the patient, with symptom treatment until now? In which situations the symptoms are better? What did you try already? And the third step also, to find out about potentials. What did you miss until now? Not only concerning the symptom, what did you miss until now? What came short, Peseschkian asked quite often. So what was not enough until now? For instance, I needed my partner to say, it's okay, I'm here for you, instead of saying, go to a doctor. So the communication with your partner is missing. What are the social resources? Who is around you? Who understands you? With whom you feel understood? And which possibilities exist around you that you did not yet see? Maybe others or special groups, self-help groups also exist. And can we in therapy now find some more, for instance, psychological parts like relaxation methods or inner safe place or whatever we can offer in treatment now? And which medical and psychological treatment possibilities exist around the client? So that's the next step then. That's the long finger to see, you have yourself already capacities to cope with the symptoms. And for that, again, I come back to what I said before. The psychosomatic clients also in the third step need our language because they have a less developed body language to understand for themselves. And they don't know quite often from childhood on how to interact emotionally with others, how to use the words. So they often have no words for feelings and cannot feel the emotions. We have to do that. And we have to be the ones who give them words for their self-perception. For instance, in a very slim person who wants to be more and more slim, anorexia, for instance, and the person still says, I'm too fat, I can give back that feeling of, you feel too fat, while people from outside say, oh, you are very slim, so that's a big difference. And how does that feel, to feel thick? How is that? Which words can we find for that? With empathy, I try to find out the words that we can use. And my emotional communication is needed instead of the emotional communication of my client. And like Peseschkian did that quite often, to find not only stories, but also visualizations. How can we describe it like a symbol, like a picture? Which story fits? Which scene is that? Or to play the role of this migraine, to play the role of the stomach, to play the role of this pain. What would the pain say? These are things that I use in the third step of our therapeutic encounter. And while we are in the third step, I can come back to some aspects that the body talks with us. Pull yourself together in English, reiß dich zusammen in German. That means keep yourself together so that you are yourself. How can you be yourself now? Or if somebody with back pain, big back pain, it broke me my back. So something is broken. Well, what do you do usually if something is broken? So you need these pictures, these symbols. Or, oh, my neck is so stiff. Oh, that means if you look around, you have to do it like that. So you cannot be flexible anymore. So you want to be flexible. Oh, yes, I would like to be flexible. I cannot. These are the things that you can also use in the third step again, symbols, stories, and so on, and to describe it so that we talk about something. It's not longer to talk with the client only, but we talk about this we talk. And it's easier for the client then to express their own feelings than if you talk about the client between the two of us. So to look at something third, like a story, like a symbol, is easier to express oneself. So far about that. That's the third step, or this third phase. of encouragement. Encouragement in the way, oh, I use what the client knows already, and I add what I could know for that situation of the client, like words, like symbols, and so on. That's it. That's all. Next step is the finger with a ring. Ring means I'm responsible. I change something. I decide something. And it's exactly what is needed in psychotherapy now, after we know the strong sides of this client, now to find out what is not possible for that client to express, what is not possible to change until now, where is the responsibility of the client, where is the self-help need of the client to overcome the symptoms. So first, again, we come back to which function has this symptom as a body language. If the body would be your best friend, what would your best friend, your body, tell you now in your situation? Oh, I always felt like I need to vomit. It's too much. It's like a stone in my stomach. If I would be my stomach, I would say, don't accept everything everybody gives you. I'm fed up with that. Aha, so your body would say, oh, don't accept everything from the others anymore. Aha, don't be so polite, you mean? Mm-hmm. And fourth finger means what until now had not been expressed. In which words you can express your secret desires. Or, better to say, for a psychotherapist, to find a psychodynamic understanding of value conflicts between the two of us. So which conflicts exist and what is it with your key conflict that needs to be expressed? And for that, I use then in the fourth step, everything that I experience with my client, because actual capacities are to see also in our relation. That means when my client is punctual, but in stress, because she wants or he wants to be very punctual, it's a capacity that causes stress. And I notice it in our interaction. Or if a client always asks, how are you, Mr. Remmers? Politeness, for instance, but avoiding the own needs, for instance. Therefore, in our therapeutic interaction, all these actual capacities come to life. And we can find out the inner conflicts and how these are worked out with a key conflict, openness, politeness. Now, there is a very special subject in psychosomatic disorders too, fourth finger, that means, responsibility. I'm responsible for my life. So subjects of death, of anxiety, of life and meaning become important in this phase, fourth area of the balance model. Peseschkian sometimes asked the clients in the first session already, which way would be your way to die? I don't want to die, I want to live. Then he said, yes, but everybody, do you know somebody who lives forever? Oh yes, Jesus Christ. Yep. And of the human beings, no, all of them die. So we have to die of something. Of what would you like to die? I just would like to sleep and just to be dead. So you could not say goodbye to your relatives. No, I would like to say goodbye. So would be cancer the better one? Cancer is terrible, but then I would have time for my relatives. So Peseschkian quite often in the beginning had been quite, let's say, open in naming the anxiety that is quite often involved in psychosomatic disorders. And he named it, that we have anxieties and fears to be very ill, to be dead. And so he named the word dead, and it's not a taboo any longer then. And then they usually came out by having a humor or smiling. Oh, now, after I talk about that, okay, let's see how it will be, how I will die. Either I can say goodbye to my relatives or not. Let's see. I'm curious about that, for instance, or something. So I had been quite often surprised how openly Nossrat Peseschkian talked about life and death. And then came to the question of what is important for you in life. What is the most important for you, and so on. So this area of meaning concerning also the word death is important, especially in psychosomatic disorders, where there is a big need of, I need to live, because there is a big fear to die. Therefore, I can name it, that taboo. That's fourth finger. Anything as remarks or questions or so? Oh, there's a little finger still, if you like. Oops. Halt. Here, broadening the goals. Also, Peseschkian, in each session, in each first interview, asked in the end, how is that now after our session? What do you want to have in mind now as your subject? What do you want to prepare? Or for the long term, how do you imagine your own future when you have the balance model here? And after that experience with your body, what do you think now? If you would be healthy, what would that change in your life? These are things for the fifth finger, to look for the situation after our session, after therapy, you can say. So far about that. So I repeat it again. First finger is I listen, much more than in any depressive or anxious patient. I listen to how the client feels and give a feedback until the client, and I wait this long until the client says, yes, now you understood it. The second, I ask the questions about the influence of the symptoms on life and how everyday life of this client is, and which are the values of this client, which are maybe even conflicts of the client. Third finger, which are the potentials and capacities of this client to cope with the situation? How did the client cope until now? How can we use that also in therapy? And which other possibilities exist that the client could do, but did not yet know? And the fourth finger, we come to the inner conflict by asking the symptom, hey, what do you want from me? Hey, body, what do you tell me? And we name it and find out, I can discuss with my body. Sometimes the body has another opinion than me. Okay, we have to discuss that like best friends. So that's internal conflict work. And then the fifth step, this client needs to live without me, without a therapist, after the first session already. That means, what do you take from our session? What do you work out after the session? How do you see your future after the session? That's something that is also now proved by research, that this question of a feedback of the session has a good result for the long-term effects of treatment. Fifth step of Peseschkian, to ask about the session and to ask about the future after the session. So far about these 5 phases. If you like, I can send you also the article for that conference here that I wrote. So you see in the chat also that little article where I summarized what I told you now, and there are some more informations in there. And if you like, I can send you also another here from this about the psychosomatic arc. So in addition to what Ivan gave you, you can also have some more ideas coming from Peseschkian and the development of the arc. So these 3 aspects here are in the chat: the slides, the article of that session, and psychosomatic arc with some ideas and also some slides in there. Okay, which questions, which ideas come in your mind? How was that for you, if you imagine yourself in there?
I would like to, yeah, sorry. It's okay, Ovidio.
Okay, so first of all, thank you very much, Arno, for this presentation. You already had this effect, at least on me, to connect things and to integrate things from different approaches. And listening to you now, I had so many insights because recently I had a lecture. I've read actually an approach regarding the senses by Seligman, and he was talking also about let's name it a sense of life. It's not going only in those, let's say, classical senses, but the sense of life was talking about those processes of the body that usually they are silent, and we are not taking them into consideration because they come online, they are coming online, and they are making some noise, usually when something is not working properly. And Sussman was talking exactly about this capability of training a bit our ears to listen in, not only in cases when things are not going well. And specifically talking about our attention that we should have, talking about the language and listening the language of our patients. I recall something. I'm not sure if it's very similar into German, but maybe you will be able to understand me. Usually we are saying, my stomach is upsetting me.
Yeah.
Why we are not looking the other way around, thinking about what we've done that we upset,
our stomach.
Our stomach, yeah. And I think it goes exactly the same way that your approach was with us today.
I think so. My stomach is upsetting me, expresses what I said, my body is my best friend. And after a while, my best friend will say, hey, did you look at that already? No, I didn't. So if it's my best friend, I'm listening to him usually even better than to my body. But when I understand my body, that's me. And my body is my best friend. So why shouldn't I listen? And then the next step is that therapeutic splitting. That's called in psychoanalysis therapeutic splitting. That means I look and listen at myself. And I listen at our talk while we have therapy with each other from outside. Oh, what are we doing? What is in me, in myself? And to have an inner conversation, like Ivan said, the inner communication that starts with that therapeutic splitting in me first as therapist, because I trained that as therapist. And my client, after a while, has also this, Arno REMMERS would say this or that. And after a while, I could see it like that. And after a while, my body talks with me again. And then we have the result of therapy, that I listen to my body finally. And the sense of life influences very, very much what I named anxiety of death, for instance, and so on. So which sense of life do I have? And my body is very much involved in this sense of life and feels that what is right, what is wrong. My body is always honest with me. That's something that I learned from psychosomatic medicine. I never saw any client where the body was lying. That's not possible. The body is always right. So the best friend is quite a good friend, I think. And the strategy of the body is to be very long, quite silent, and to say, okay, you'll do, okay. But if it's too much, then the body will be straightforward and say, not with me. Now you are tired. Now you are ill. Yeah, now you have pain, and so on. So it needs a lot of patience of the body until the body talks in such a way that psychosomatic symptoms arise.
Thank you very much, Arno. And Gabi, you also had an...
I wanted to ask you, Arno, from your experience, how long is therapy for a psychosomatic reaction or symptom, not for disorders, because in disorders we are talking about something else, but when we have symptoms and reaction, psychosomatic reaction, for how long you work with your clients?
That depends on the type of regression. If it's a very strong regressive symptom, that means it brings you back to childhood experience in early phases. It needs long time. If it's a symptom that does not exist since long time and it's not related to old basic conflicts, but it's now a reaction of the body on something that's actual, that needs a very short time to understand it. And by understanding it, it can be changed. While the classical psychosomatic disorders like asthma or when heart attacks come up, they cannot be understood. I can name them as long as I want. They will not change. They will change with the therapeutic relation that grows. They need that attachment in therapy to be understood as something that is working within my client, with my client, and it needs a long time until we have a language for that. So in a diagnostic way, you can say the more the psychosomatic disorders are linked to structural difficulties to understand oneself and to communicate with oneself, the longer you need an emotional correcting therapeutic experience and relation to change that step by step. And it will go away without noticing it. You will not talk about the symptom anymore, and the symptom will be less and less while you have a better therapeutic relation. And there are other symptoms, only symptoms, not disorders, that can go away quite fast when you understand, it's always when I go to that boss that I feel so bad that I cannot go there and I'm ill. That usually is to solve much more easily when you find names for it. So you are aggressive with your boss. No. So you are really aggressive. Yes, I could sometimes beat him. Huh? You could beat him? Yes, I could beat him. And when it's expressed, when you can name it, it's okay with the symptom. You don't need the symptom anymore. But it's a high integration of the structure, or better to say, in Kernberg or OPD, they say integrated personality. I see it as flexible personality. If somebody is ready to be flexible in a given situation, to react in different ways, psychosomatic symptoms are not needed anymore. If somebody has a one-sided way to be like a person and a personality, it's much more difficult to change the psychosomatic disorders because they are needed for that personality to express something. And it needs more time to develop something in therapeutic relation then. It needs months, sometimes a year, or even sometimes longer. But the most symptoms become better after some weeks of a therapeutic relation. If we don't talk about the symptoms so much, so after some weeks or months, we notice, oh, the symptoms are gone. Strange. And it's not needed anymore. Because instead of the symptom, we have another way to express what the body wanted to say.
Yeah, this is very interesting how the end of the therapy is when the client forget about the symptom. So as long as they come and say, yeah, I had no migraine this week, this is not the end of the therapy because the attention of the client is still there on the symptom. But when we ask the client, how is your migraine? And he or she stay and think and said usually, I forgot. I don't know since when I don't have this migraine. That's the end of the therapy.
Yeah.
I have a question.
Yeah, please. Yes, Christina.
Sorry, I just wanted to ask Arno. I was thinking actually, using this approach that you showed us. Is this something that, well, two questions actually, but I will ask them both and let you answer afterward. Is it possible to use this approach on ourselves? And the second part of the question, would it be possible to teach our patients or clients somewhat of a simplified version of the approach so that they can use it for themselves if they have this kind of symptoms again?
It's a little bit difficult. Usually you need a relation to find these words that you don't have yourself. So that's the first. For many of these symptoms, another person is needed. It doesn't need to be a therapist, but a person with whom you can really share what you feel, and the person is ready just to listen to you, for instance. So you need a person for the most expressions you cannot find yourself. But practice shows that you can, when you have these 5 steps in positive psychosomatics, when you first write down how you yourself feel your symptoms, for instance, and some days do that. Whenever you have it, or in the meantime, you write it down. Then leave it for a moment. Then look at it and say, okay, how does this influence my life? Second step then. And write it down. How did this until now change my life? And then you go through the balance model. Then you go further. And then you write down, okay, in which situation is it better? What did I do until now? So in this way, it might be possible in a written way to do it for yourself. Writing, that's the idea of Nossrat Peseschkian too, writing down the symptoms, writing down how you feel, writing down your own balance model, writing down how you coped with that before, means you can reflect it with your paper instead of with another person. So it's a self-reflective method that is suggested by Nossrat Peseschkian, to write that down. And in the fourth step, you can play it with chairs, for instance. On one side, I see that. On the other side, I see that. But it's easier with a person, not alone.
Okay, thank you.
Thank you, Christina.
I also wanted to add the importance of attachment relationship with our client, and how you said that sometimes 1 session, 2 sessions, 3 sessions, we stay and listen, and we provide the reattachment, which means time, patience, and contact with our clients. This is let's say a goal of the therapy, to provide the reattachment, a new kind of attachment for our clients.
I think we have to let's say, we have to have attention to the word attachment again, attachment theory of Bowlby and so on. It has such a strong influence on our therapeutic relation, on our client in the therapeutic relation, and on our whole life, like Ivan described it in the arc, that this contact is so important, that the emotional communication with ourselves and with others is so important. All this is part of attachment also. So this way of having a new kind of attachment in therapy is part of treatment. So attachment as such is a very important tool in psychosomatic treatment. And we have to name it with the different aspects, like having time, being patient, to trust in oneself. I trust in my client. My clients didn't trust in the body, but I trust in the body language, for instance. So all the primary capacities are the most important at that treatment. Especially the secondary capacities evoke inner conflicts in such clients. And the primary capacities are needed by other persons to be experienced with another person. To have trust in your own body, you need first to have trust in another person, and another person needs to have trust in your body, and so on. So far. Thank you very much.
Can I have another question? Sorry, I don't know if we still have time.
Ovidio, is that okay or not?
I think yes. We still have like 2 minutes, so
yeah?
it would be okay. Sure,
Christina? Yeah?
Okay, thank you. Just quickly, I just want to make sure that I understood the third step right. You say that the third step is about starting from the question, how did you cope with it until now? Yeah. And are we talking about how did you cope with the symptom that you are having, or how did you cope with whatever it is that is causing the symptom?
It's more about how could you experience the symptom changing. What did you do so that the symptom changed? When was it worse? When was it better? And in which way it was better? What did you do to feel better, for instance? And independent of the symptom, in which way do you feel well, for instance? In which situations and so on you feel well? All this is third step. So-called situative encouragement from Alfred Adler is that word encouragement. That means to find out what the client has in herself or himself that this client already used or can use or could use.
It's clear. Thank you so much, Arno.
Thank you very much, dear Arno. And yeah, we can see at least one of the advantages of this pandemic, the easiness in connecting with you, because otherwise, if we would have the conference in Cluj, maybe it would have been more difficult for you to join and attend. So like always, great pleasure to have you and to listen to you. Thank you very much. And now we'll have a break. And after that, we'll come back in the conference with we'll continue with the presentation. So